but the approval is on the table. Just to remind us, this is for the, what is it, 730s that we have to pay according to the state,
Correct.
correct?
Yes.
Any questions? All right, move to a roll call vote.
Martini,
Aye.
Basile,
Since I didn't hear the conversation, I've been,
upstairs,
yes.
Bliss,
Yes.
Yes.
Mendez.
Yes.
All right, hearing no nos and one abstention, the motion passes.
Thank you. And because of this bill, I have run out of money in my budget. So I'm requesting $30,664.56 from contingency funds to transfer from A1990-548000 to A4390-546960, and that would go into our criminal actions budget line in order for us to pay this.
Okay, is there a motion?
So move. Second.
Questions?
Jeanette, Steve here. Assuming these, what I think are two individuals we have to cover, right? Roughly what will be the monthly cost if they last for the whole year?
So one individual for 1 month. And just to give you a heads up, another one went last week. I got notice that he arrived, so we'll be covering 3 individuals when I get the next bill.
Okay.
So one person for 31 days is $50,914.71 if they continue to go to the same facility. Each facility has a different fee. Some are much more, some are a few dollars less, or right around the same fee.
So right now, we've got 3 people then, is what you're suggesting.
Correct.
Okay, so roughly speaking, 150,000 a month going forward.
Yeah, as long as, it depends how long they're going to be in there. And I'll also just let you know, we have 3 more 730s that are scheduled. So based off of the findings of them, there may be more individuals going as well.
So we are paying for August with this action we just took?
No, this bill, the 70,000, is actually from June 1st through June 30th. They always send it like a month behind.
Right, so essentially, we've got kind of, it's not exactly worst case scenario, but 6 times 150. We're getting on. Okay.
And I don't know that there's even place we could apply for relief. Like,
No, I don't think there
I
is
think
either.
this is just what it is. There's,
So we will probably exhaust I'm guessing we're gonna exhaust our contingency before the end of the year. I don't think we're gonna get into like a budget deficit situation because we applied so much of the fund balance last year. I think it was close to $10 million. So that's kind of what I'm thinking at this point. I think we should closely monitor this. So as Jeanette has suggested, let's do this month by month. Normally, it would be more efficient to do it in chunks, but given the extraordinary uncertainty.
all Are we waiting for a vote? Yes, on this second batch.
Okay. Martini.
Aye.
Basile.
Yes.
Bliss.
Yes.
Rockaway.
Yes.
Mendez.
Yes.
Hearing no no's or abstentions, the motion passes.
Thank you. Next on my agenda is I'd like approval to spend $1,000 on Recovery Month for September for the addiction recovery services, and this would come out of our opiates money that we've received.
Is there a motion?
I'll make the motion.
Is there a second?
No second.
Any questions? All right, move to a vote.
Martini.
Aye.
Basile.
Yes.
Bliss.
Yes.
Rockaway.
Yes.
Mendez.
Yes.
Hearing no no's or abstentions, the motion passes.
Thank you. And the other two are just informational, just to keep you updated. We are writing off $2,435.32 for the addiction clinic, because those services were provided by an intern and we're not allowed to bill for an intern. So we did want to make sure you're aware of that. The next piece of information is that we did receive notice of our payments for uncompensated or underpaid services in the amount of $58,116. And this is for a period of April 1st, 2025 through March 31st of 2026. And we will be putting that money into our fees budget line.
Any questions? Any further pieces of information?
Yes.
All right.
Okay.
Thank you.
All right. Thank you. Have a good day.
You too. We're 5 minutes ahead. How's that? I do know that at NISAC in September, there's a workshop about 7:30s and what we can possibly do about it. Which at this point is nothing, but
Right. It is a big topic of conversation on the county administrator listserv, as you might imagine. Usually just howls of frustration more than
Yeah.
anything else. You know, if we want to move forward, I think we can talk about that opioid
Sure.
stuff.
yeah.
So the question, I just gotta make sure I can see this. I think you have a piece of paper that Bob created. And what we're looking for are kind of two things. One, we need to move some money from the opioid reserve into the Department of Health revenue line called opioid settlement. And then from there, from that revenue line, it's a modification to Department of Health contracts. The total amount is $278,000. And this is the amount for all of the first year of the contracts that we did a resolution on a month or two ago. This will allow that to be executed. So I think we would need a resolution or a motion for a resolution to accomplish that. In addition, and we can do this in one or do this separately, we have 3 annual purchase orders that, because of the high dollar amounts, we need to get committee approval for those. And those are for $85,000 for the Fordo contract, $55,000 for the Trellis contract, and 138, almost 139 for the Mohawk Valley IPA. It's not a beer, that's an organization. If we can get those approvals for those purchase orders, we can go ahead and start paying these out for the rest of the year as necessary. We currently have one invoice pending. This is the advance payment for Florida.
And this came out of the opioid settlement sub ad hoc committee that we had put together. And we're gonna start up again here in just a matter of weeks because there's still money in that. So,
And growing slightly.
and growing slightly. I think we could probably do this just as one. Motion. Is there a motion to go ahead and move the numbers around? So moved. Second.
Second.
Any further questions? Great, let's move to a roll call vote.
Martini.
Aye.
Basile.
Yes.
Bliss.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Okay, hearing no no's or abstentions, the motion passes.
Bob was able to get up here. Did I, is there any additional information about this transaction that's relevant? I mean, I told them basically all the cash is going to you and me, so.
Right,
they
and
were-
they've already voted, right?
Yeah,
Yes,
So, I mean, you've already made up your mind, why should I try and change it?
very good.
awesome. And Bob, in a few short weeks, I'll be contacting you again to start the next.
Okay, looking forward to it.
Yeah, I'm not. Any questions? Okay, all right. So moving on to DSS. Gonna hand over to Commissioner Winnie for able staff.
First on our agenda, we'd like to request a resolution of contract with the county attorney's office for Monica DeFry services to DSS. Part-time, so she'll do a time.
Great. Is there a motion?
So moved.
Sorry. Any questions? Move to a roll call vote.
Martini.
Aye.
Basile.
Yes.
Bliss.
Yes.
Brockway.
Yes.
Mendez.
Yes.
Hearing no no's or abstentions, the motion passes.
Thank you. And we just have a question maybe for Steve. How to, do we do a budget transfer for this? So we'll pay a portion of the salary.
This
For
is
the
for
time
next
spent.
year, right?
No, this is for now. Because we have a social services attorney vacancy.
Yeah, I guess, that makes
So we'll
sense.
just do
to
a
me.
transfer from personal service for our vacancy money, the contracts, or,
This is for. I don't know.
to pay the county attorneys. Okay, so we'll discuss it. We can discuss it
I don't
after.
know the answer,
Okay.
just to think about it.
Okay. Figure it out after,
Yes, assuming that,
assuming it's all approved.
Yes.
Right.
Huh.
Sheriff.
I think you actually stumped him, so there you go.
We'll figure it out.
You go
Before
home now,
admin.
you've achieved, right?
Okay, pass it off to Cheryl for fiscal report.
Good morning. Starting with the welfare admin report. We are, for June 25, we are at an overall percentage of 35.89. Records management, overall 48.68. Agency housing, overall 45.77. All lines seem to be okay, a little over, a little under, but doing okay. Moving on to the program area, we are watching POS and safety net. They're both running a little high. We'll keep watching them, possibly need a few transfer in the next month or so. But overall, it is still okay at 46.98.
This is personnel. We hired 2 new staff the past month, a temporary social welfare examiner and a caseworker. And we have 3 new vacancies, clerk, a paralegal, and a caseworker. Okay, motel monthly stats. At the Otsego shelter, we're housing 5 families. Hotel 88, we're utilizing 6 rooms. Crossroads, 11 rooms. Genie's, 0. And agency housing, 9 homes are occupied.
And are all of the tiny homes up and running at this point?
Right, as the last one has its, yeah,
Okay.
so they're all ready.
Great. So that's
So
10
just looking
total.
for, yeah, an additional.
Okay.
There was a question that came up at the board meeting about TVs. So I reached out to Jeanette and she said there is potential positive impacts and negative impacts to having TV or not having TV. So it could go either way, depending on the individual circumstances.
Okay.
Individuals' mental health, or
Right.
whatever, what they need, what they may need for coping or not.
Was the question, I feel like the question was whether or not we legally had to provide. No,
So
that was not the question. This is what
I
happens when
think-
you're kind of.
I think that, I mean, it sounds to me like if all the tiny homes are ready, the question has been answered, is that they're occupied now because they have
Right.
internet and TV.
yes,
Or
But the-
they can
just
be,
one.
they all can
They're all
be
ready.
occupied now.
Exactly.
Okay,
There was 2 that didn't, and
that's been rectified since the board meeting.
perfect. Oh, yes.
Okay.
Oh, sure. OPD for the past month had 10 calls to Motel 88, and 3 of those calls involved ESS individuals.
And I have a request, and this is not something that you need to answer right this second. But I've been approached by constituents looking at potential impacts to Medicaid and Medicare based on what's happening at the federal level. And I know that your agency is, DSS is gonna feel those, first. Would it be possible to prepare something to give us a sense of, and I know it is changing hourly, but, whatever you can gather up,
I
that
will
would
do
be
that.
great. Thank you.
Okay.
You share that with us too.
Absolutely.
Hopefully it'll be roughly similar to what you prepared for the budget
Yes.
process.
Right.
Unless it isn't, I mean, we don't know.
Yeah, it's a couple weeks later, God knows what it is now.
Right. Okay, that's all we have.
Great, thank you.
Thank you.
Miss Reed.
Good morning.
Morning.
Okay, first on the agenda, I have a request to accept our annual Alzheimer's Caregiver Respite Grant for $20,000. We use this funding to be able to assist with the caregiver respite in the home as well as social adult day programming throughout the county.
Is there a motion?
I make a motion.
Is there a second?
A second.
Any questions? Right, hearing none, move to a roll call vote.
Martini,
Aye.
Basile,
Aye.
Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Hearing no no's or abstentions, the motion passes.
And the second request is to transfer funds from our senior meals and our in-home services line in order to purchase a new handicap van, which would be providing our medical transportation service. So this year we overloaded those lines, because of the past 2 years of increased costs. But we were able to receive additional state funding this year. And we also had, funding from Care Compass, earlier in the year. You may have recalled, we brought in about $28,000 of unrestricted, revenue. So we're gonna move those funds, and we did choose this time around. Previously, we went through enterprise to lease a vehicle. That was not a good model for this van because we actually have the minivan customized with a manual wheelchair ramp. So that's a vehicle we obviously want to keep and sustain and not customize it every 2-3 years, when enterprise wants to. So we're asking to move that funding so that we can then purchase a medical transportation vehicle outright for our department.
Is there a motion?
So moved.
Second.
Any questions? Right, hearing none, move to a roll call vote.
Martini?
Aye.
Basile?
Yes.
Bliss?
Yes.
Brockway?
Yes.
Mendez?
Yes.
Okay, hearing no no's or abstentions, the motion passes.
And we're working with Onondaga right now for that bid process. So you'll probably next month I'll come back with those proposals. Third is to request to purchase lunch for up to 30 mental health first aid training participants. We were able to get a grant to pay for the actual training itself. And this would just be to be able to purchase lunch for the participants. This would be our entire department. Every single staff member would be participating in this. And then we've also opened it up to Adult Protective Services and some of our neighboring OFAs if they want to send a couple of staff.
Great.
Second.
Any questions? Hearing none, move to a roll call vote.
Martini?
Aye.
Basile?
Yes.
Bliss?
Yes.
Brockway?
Yes.
Mendez?
Yes.
Hearing no no's or abstentions, the motion passes.
And I don't know, Steve or Alan, I don't know if you guys already have ClearGov up, if other people are doing their quarterly reports.
I do have it up, Tammy. I can bring it up and share it for you if you'd like.
Awesome, thank you.
So we should have expected our different offices to share with you their quarterly updates for the second quarter. It is, of course, a work in progress. So hopefully we'll get more work on this as folks get used to having to do this.
Right. Yeah, was that expectation reiterated or? Okay.
Yes. Now, I should say we have much greater compliance, if you will, in actually putting stuff into the plan.
Right.
So there's a lot of information that is there. It's not complete, but there's a lot that is there. I think we just need to, make sure folks, the point of all this is to actually have the discussion with you, not to fill out the form.
Right.
So.
Okay.
So Alan, if you want to either just go to, yeah, perfect. Okay. So we had 5 priority outcomes that we had identified. We're really not changing those for 2026 budget year. These are probably going to be the same priority outcomes that you'll be seeing this year and into next year. This first one was obviously just to focus on our main core services, which is being able to keep people in their homes and out of nursing homes. And so I'm not going to go into this one because this is one that we have already met because of the various contracts we have with a number of partners to help us do this work. So we can go to the second priority outcome. Okay, so this is the area where we're focused on supporting family caregivers. This is always a growing population that we're trying to keep pace with. If you want to go into, if you scroll down to some of the action items, perfect. So this one we're doing great with. Obviously, I think we have at least five different people that we're contracting with. And then the next one. And this is we're working with we haven't had anyone refer to this program yet, but we are definitely working with both our Albany VA Medical Center and Syracuse VA Medical Center. Overall, we're seeing a lot more referrals to our veteran directed care program. So we do anticipate in the coming year to see more of the caregivers actually utilizing the respite program that's available through that entity. Go to the next one. So we are continuing to look through grants. Obviously, the one that you just approved today, that is one of the grants that we continually apply for and are grateful to receive to help with the caregiver respite. We have our Title III funding that we apply for every year. And then we're just kind of keeping our eyes open. We've looked at a couple of different grants that just aren't a great fit that we have actually passed on. It would have been more work for what would have probably really given our caregivers any kind of respite from. And the next one. This is essentially we implemented a brand new assessment tool. Previously, we had our standard assessment tool that we had everybody go through. This one is a tool that's very specific to caregivers. And so we have implemented that new tool and we're on track for that portion of it. And then finally, this was to explore an opportunity to partner with local colleges. So we've met with SUNY Oneonta this past summer. They are on board for the spring internship. And we've developed an internship that would really help students go into the home and work with probably 3 to 5 different families to be able to provide respite. So we're really excited about that. We also, just this past week, I've been working with Wendy over at Personnel so that we are on, our department is added on to Handshake, which is the platform that the colleges use for all of their internship processes. So our internship is now included in that. So we're hoping to see some movement in 2026 for that component. Okay, so then, yep, this is our next. Did anybody have any questions so far? Okay. Our third priority outcome was to increase community outreach. One of the things we've always said is we're often best kept secret. So this was an area that was really important this year to expand. We've done our staff have done a great job of really getting out into some different venues and different events that maybe you wouldn't typically think you'd see an Office for Aging at. And so we're just hoping to continue to make people aware that we're here. When they need that support, they can reach out and we can help them navigate. So we can go into just a couple of these, I think. So we continue to do our various events in the community. Just want to scroll down. Can you scroll down a little bit, Alan? Perfect. So we've been doing a lot more presentations throughout the community, bringing different speakers and things like that in and expanding. We've been trying to identify, what are the areas that people are interested in and really need to hear about. So we've been able to bring in different expertise panels to do that. Again, as you saw, we're going to be doing the mental health first aid training, making that accessible. We also are doing different classes on like polypharmacy. And then scams and kind of our typical preparing for the aging process series that we do both in the spring and in the fall. And then if you want to jump to, I think, our fourth priority area. I think this one's housing. Yes. Okay. So this area is in regards to our housing, and continuing to expand that. So we've been working with a variety of different groups, on this area. I'm actually, more pleased with our overall progress on this one, because at the beginning of the year, I thought this would be a little bit more daunting for us, but we've been really excited to see some good movement in the community. As many of you already know, the Christopher Communities is going to be opening a senior housing complex in Richfield Springs. They've engaged us in that process, and there's various community partners already involved in that. We saw that the St. Mary's School in Oneonta is obviously being transitioned to senior housing. Great location, accessible to transportation. Really excited to kind of partner with them and engage those populations. And then there's just different home modification and activity through our own planning department that's happening, as well as a private owner who is looking to transition his current motel spaces into permanent housing for seniors. So we're really happy to see a good amount of movement. Obviously, we would like to see some more diverse senior housing within our community for just different types of options for downsizing. But we are really happy to see that not all of the housing that's coming available is subsidized, because I think that was part of what we were seeing. There wasn't kind of that market rate type of housing available for those that would be over income for a subsidized unit. So we are seeing a little bit more diversity, thankfully. And then the last priority outcome we've identified is transportation, a never-ending battle in rural America. But we're really excited. This just launched last month. So we are in the midst of recruiting volunteers for the volunteer transportation service through Get There. And we'll be doing a lot more recruitment for the next several months, and being able to lift basically a volunteer program to help with medical transports, grocery shopping, and hopefully, different socialization opportunities as well. Any questions on some of these areas, or thoughts or ideas or help that you'd like to offer us?
I think you all are doing amazing work and really chipping away at some of the long-standing issues in our community. It's great to see so much senior housing coming on.
Yeah. I think good point. These aren't new issues, but it does feel like there's actually movement happening, which is nice.
And I really appreciate the time you take, Tammy, to go over these with us. I wish all the best. Thank you.
Thank you. I think probably the only area that we are starting to see a lot more growth in is our, the behavioral health population, which we're seeing it across the board in every arena, but it definitely is taking a lot more demand from our staff time that, we typically weren't used to. So I think in the next year or two, we're going to see what the impact of that is, and trying to figure out how to better manage some of the anxiety, depression, and just increased demand on our office to manage some of the behavioral health. So we've been meeting with Marion Mossman with the IPA and some of our other partners here in the community to try to figure out how we want to address that. That's it. That's all I have.
Great. Thank you, Tammy.
Have a good day.
You too.
Thank you.
If I could just add something about the strategic plan real quick. It probably seems slow, kind of riffing off of your comment about other departments. If you were on PRGS, you may recall that we're going to actually evaluate how people, if you will, participated in the quality of their strategic plans and stuff like that. This first year is a freebie. I'm going to talk with all of the department heads one-on-one and kind of go detailed. Did you do quarterly updates? Did you have a discussion with your et cetera, et cetera, et cetera? I think that will move it I think that will show improvement in next year. So I know it feels kind of slow at this point. But I think that will help as people get used to that. Remember, that conversation is to explain to folks and help folks understand what it is we're looking for. For some folks, this is like, they don't get it at all. So it's a mix of education and kind of gentle pushing. So don't get depressed.
Well, at least not with this. I mean, there's plenty
At least not with this. I have another list if you want to go through that, but we probably shouldn't.
Okay, handing off to Heidi from.
Okay. Thank you. I'll start with program updates. And I wasn't prepared to talk about my strategic plan, but I will. As long as Alan will provide me his laptop, I will go over it. I just wanted to start with program updates. We have seen an increase in anaplasmosis cases, a pretty significant increase. Lyme cases have been rising, over the past many years. We're doing a lot of tick education outreach in the community. I think they're going to the Elks Club in Oneonta today. We have tickets available, so we're trying to
Tick kits.
tick kits.
Got it.
Tick removal.
Tickets available. I'm like, to go to
Tick-
the Elks.
Yeah.
I'm back
Tick
now.
removal kits. Yep. Yeah. There was a small uptick in COVID in June. I think it kind of plateaued into July and coming back down again. Not unexpected. It's kind of what it's been doing. Our next rabies clinic is on August 21st in Neowa Park from 6 to 8. We have had 2 positive specimens this year. We have been sending in a lot of bats. We've been really busy with bat exposures. So typical for this time of the year, especially with the warm weather. So not anything too unusual. I did want to highlight, I know I mentioned it last time, our early intervention services. We have about 130 kids on caseload that all kind of in various, parts of the process. We have 28 service authorizations that are not filled. So that's children who, or 28 services that children should be receiving that they're not getting services because we don't have a service provider. It affects 23 children. We have 7 OT services, 2 PT, 13 speech services, and 5 special instruction, and 1 respite care. Continuing to do I'm doing work on like the statewide level with NISAC and NISHO trying to bring attention to this. The early intervention program is we're 50th in the nation. New York State is at the last for providing early intervention services. We met, a couple of us met, NISHO members met with Division of Budget last week to talk about early intervention services, and they really didn't say anything. Not that they probably could, but the state owes the counties over $170 million in Medicaid retro payments. And that's just from 2013 to 2018.
So early childhood Medicaid payment?
Yep, early intervention.
Early
Yeah.
intervention.
Yep. So that's just for 2013 through 2018, and we suspect it's over 170 million from 18 to current time. I'm trying to figure out how much we're owed, working with the treasurer's office. So I don't think it's a huge amount of money, but it's significant even for the smaller counties. And the state is holding back about 5 years ago, they passed a covered lives assessment for early intervention so that providers didn't have to bill private insurance companies, which they don't generally pay, and then they would get denied, and then it would go through the escrow and the county would pay anyways. So now the insurance companies pay a covered lives assessment of 20 million, but the state took 5 million of that. And the state hasn't paid out, we're owed like, counties are owed millions of dollars. So there's a lot of stuff going on. And I know, with Medicaid, and this year is not a great time to be talking about all the money that's owed to counties, but
It's still.
it is what it is. Yeah. So the only item of business I had was to accept our public health emergency preparedness grant for a time period of 7/1/25 through 6/30/26. The total grant award is $52,099. It was level funded. This is one of the grants that was up in the air for cuts, but the state did receive the funding and have the money, so we're funded for 1 year.
So moved. Second.
Any questions on that? All right, move to a vote.
Martini,
Aye.
Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes. Okay, hearing no nos or abstentions, the motion passes.
Thank you. And then I wanted to ask for an executive session, but do you want me to go over my strategic plan first?
Yeah, why don't we do that? And then we'll.
Okay. Okay, so first one, prepare preschool age children with disabilities for kindergarten. Mostly, the county is fiscally responsible for pre-K special education costs. Y'all know that. They cost a lot of money. The school districts tell do the IEPs, which says what the kids need, and then the county pays. So, we also have, a special educator, 2 special educator positions. We were just able to fill our vacant one. It's been vacant for over a year. She's gonna start next month. So hopefully we'll be able to provide some of the unmet needs that have been happening. But we do fine with this. We try to keep costs down where we can and contract with third-party vendors to provide transportation. This is actually going much better than last year. We, if you remember, we went out to bid about a little over a year ago, new contractors, and things have been, knock on wood, going very well. We have not had the issues like we had with the previous contractors, so it's going well. And along with this, I still have been working on, this is a very costly expense too for the county. So I have been working kind of trying to get school districts to at least start the conversation about transporting their 3 and 4-year-olds to program. We know that it costs a fraction of what it costs for the school district to transport. It costs a fraction of what we're paying. And sometimes we're taking kids from the same house to the same place, just riding on a different bus. So continue to work on that, but things are going well. I kind of touched on this, provides direct special instruction. We have an agency, so we're able to provide in school or in daycare or home setting special instruction. So when we're full staff next month, we'll have 2 teachers able to provide special instruction to preschoolers with disabilities. So that's an improvement since we've been down staff for a year. Also providing evaluations for children 3 to 5. We're an evaluating agency. So when school or daycare or a parent makes a referral for kids who they think might need services, we're able to do the evaluations. And we've been, in the past, we've had some waiting lists and kind of get backlogged, but we're doing pretty well keeping up on those this year. So. Same thing, kind of, I struggled with this, like with the preschool stuff, because it's all mandated and like, we can't really do a lot of different things with it, but we try to be present at every IEP meeting so that the county has a voice in services that the children are getting. and keep our billing up to date, so we're getting revenue. Maintain programs designed to reduce the prevalence or incidence of chronic disease, disease and conditions. I did hire a nurse who then didn't work out, so we had to let go. So this is kind of one that we're not doing as well on as I'd like to. I just don't have the staff. But having the public health educator that I have, we do touch on high level chronic disease stuff, diabetes, obesity, that kind of stuff. So, but if I can ever get fully staffed, I would like to put more time and effort and support into chronic disease. We kind of do this, well, right now we're in the middle of doing our community health assessment, but we kind of do this, you know, collect data and look at where areas of need are popping up around the county, and we're actually using a lot of the GIS technology to do that, which has been extremely helpful, so that we can localize, you know, communities where we might see a need for some intervention. We do participate with a lot of community organizations. We go to the colleges a lot. We're out in the community. Especially now that I have the special educator, we are out in the community a lot more, which is great. And people are calling us to come and do health education presentations. And so people know we're out and we're getting asked to participate in a lot of things. Back on chronic disease, like I said, we're doing the bare minimum, but I would really like to be able to do more. I can get a nurse hired and be able to do that. Communities health assessment and community health improvement plan. We are working with Bassett. We're writing it this year. In the past 3 or 4 cycles, Bassett has written it. But we're taking the lead on writing it this time, working closely with Bassett. We've done the community assessment, so we've done the survey. We're in the process of analyzing that data. We'll have hopefully by mid-October, early October, have a report out, presentation to do community outreach. So have people come in, listen to our presentation on what we heard from them, and then hopefully let people decide what our priority areas are going to be for the next 6 years. Maintain a program to minimize incidence of communicable disease and conduct timely surveillance of arthropod-borne diseases. I have a communicable disease nurse who every day is retrieving lab reports from the state system, so we're following up on those same day or next day as the state, you know, expects us to, and identifying any clusters or you know, anything that doesn't seem right. We're working with the state on those. I kind of along with that. We do have. We are able to accept 24/7 disease reporting results. After hours, the state system calls my cell phone, the assistant director's cell phone, and dispatch. So we're able to get those results after hours.
How often does that occur?
Not very often. Yeah, we had a meningitis case. So we had like 3 alerts in the past week and a half, but that's unusual. It's a couple times a year, not very often, thankfully.
Yeah.
We are doing pretty well with investigation within 24 hours. Like I said, I only have 1 nurse doing this, but she is doing really well. And my assistant is working on some QA activities on timeliness. So I'll have more to report on that when I have those. This kind of goes, like it changes throughout the year, so we're beginning to look at, doing influenza outreach. Right now, we're into tick and rabies prevention, so kind of, goes with the season of what, the topic or disease or risk is, highest at that point. We tend to, alter our trainings to the need at the time. Unintentional injuries, we have mandated a lead poisoning prevention program where all kids at 1 and 2 are supposed to be screened for blood lead levels. And then right now, the actionable level is 5. So if they're above 5, they're gonna get a call or some information from us. There's kind of discrepancy in the state because the state lowered the actionable level, but they didn't provide any funding to the counties to do that. So we're kind of in this period of, well, how are we managing this without extra funding? But thankfully, we don't have a huge burden of lead poisoning cases, so that's good. Abby, the public health educator, has started our kind of like an overdose response program. She's got some outside funding for that. Things are going along pretty well. We have the Narcan vending machines at the meadows and out in the community, so things are moving along with that program. We do have 4 certified car seat technicians. We do work with the other community agencies who also have car seat techs, and we do car seat inspection events within the community. We do convene the Suicide Prevention Coalition, Safe Otsego, and that has been, it kind of fell off during COVID because we didn't have the time or resources to have that up and running, but we are up and running again and meeting regularly.
Yeah.
Okay. Prepare families with children 0 to 3 with developmental delays to gain access to services. This is our early intervention program. And this we are struggling with, especially when I updated the community or the strategic plan, I added the first actionable item there that says manage cases to ensure children improve their services, receive services in a timely manner. Because I felt like in the strategic plan, I didn't really have anything that was measuring how well we're doing, which we're not doing well. So I'm hoping to be able to show over time, how many children are waiting for services, and does that change? Are we doing anything that's making a difference to get services to children in a more timely manner? Intervention program to community and healthcare providers. We generally do a targeted outreach to our healthcare providers about once a year to go and visit the pediatric and community providers to just remind them of the program, remind them how to make a referral, and what the program is. And we always have, when we do tabling events or have general public health tables, we always have early intervention information to share. We provide case management. I have 2 family service specialists providing case management to children. Engage parents in developing a family-centered approach. We are doing this. It's mandated that families are involved in writing the individual family services plan. Thank you. Any questions? I don't know. I thought maybe mine are too detailed. Like, should they be more, like
Broad.
Broad.
Yeah.
I mean, I don't think so.
Okay.
Now, one thing that might be helpful is if somewhere in their departments get to know what is mandated and what isn't.
Okay.
That might
Oh,
help
yeah.
clarify. Might help clarify.
Okay. Thank you.
All right, and you wanted an executive session?
Yes, please.
For
Personnel.
personnel, so I move that we do something.
Also, remember, we've got Jacinda doing
Yeah.
the financial side.
Yeah. I figured we'll do this and then.
Yeah.
So I move that we move into executive session for reasons that involve medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. Yes, is there a second?
Second.
So we're gonna move into executive session, inviting in Steve. Inviting in Steve.
Thank you.
Recording stopped.
welcome back to the Human Services Committee meeting on August 12th. Is there a motion to emerge from executive session?
Make that motion.
Is there a second?
Second.
We're back. And now I will hand it over to Ms. Jacinta.
Thank you. Okay, our second quarter spending overview shows a expected spending amount of 61.3 million, or 29% of our $150 million revised budget. Actual spending through June 30th was over 57 million, thus underspending according to the projection by 4.1 million. The revenue overview shows a second quarter expected revenue amount of 62.7 million, or 31% of our $142.4 million revised budget. Actual revenues through June 30th were 54.3 million, thus incurring a revenue shortfall of $8.4 million according to the projection.
You might have seen Alan Ruffles' emails a couple of days ago about this.
For countywide spending, DSS continues to see underspending in personal services due to numerous vacancies throughout the department. The department currently has 33 full-time and part-time vacant positions, with some of these vacancies dating back to 2022. This is an increase of 2 vacant positions from the first quarter. We'll skip to 7. For our countywide over revenues, health is seeing increased Medicaid revenue as mentioned in the first quarter. Medicaid had system issues and provided retroactive payments, increasing the amount received in a lump sum payment. The revenue received was then posted in February of 2025, but should have been backdated to show as revenue received in 2024. Due to this, this line will continue to show as over since it accounts for prior year revenues. For contractual overspending, we're seeing DSS in their safety net. This line accounts for single adults and childless couples who qualify for temporary assistance. As mentioned in the first quarter, the number of qualified individuals has increased, thus increasing the funding needed for benefits, burials, rent, and utility payments. For contractual underspending, we're seeing community services. As mentioned in the first quarter, there are no expenditures recorded in the RSS and the RSS reinvestment account lines. These 2 budget lines historically account for over $1 million in actuals year to date. Jeanette has stated that these lines, along with additional underspending in LEAP and Fordo, are state aid specific amounts that are paid out each quarter. She anticipates that as the year progresses, this account will fall more in line with what the county is looking for.
We just, the auditor just approved some RSS invoices, I think it was last week. I forget the dollar amounts, but so there's something gonna be showing up in the third quarter.
Position overview. The county accounted for 508 employees on payroll at the end of the second quarter. This is an overall total increase of 19 employees. Employment and training saw the largest staffing increase countywide, with a total of 22 employees over 2 major codes for their summer program. RIV monitoring under community services also saw an increase this quarter, while while health, had a decrease of 1 employee. For our vacancies, our rate currently stands at 20%, which includes full-time, part-time, and temporary positions. Of our 570 budgeted positions, 116 of those are vacant. This is an increase of 5 vacant positions from the first quarter. The highest number of vacancies are seen in DSS, the Sheriff's Department, and Highways, which account for 11% of the overall vacancy rate. DSS has vacancies dating back to 2022, with 3 positions having been vacant since creation, which is a case manager, a casework aide, and a social welfare examiner. Community services as a whole had 18 vacancies this quarter, with one dating back to 2022. 5 of these positions have been vacant since the creation date. Year-to-date, budget changes have been seen in aging and social services, and our budget changes through the second quarter now show $238,000 being moved from contingency. Changing.
Yep.
Substantially.
Yes. For our watch list, the watch list from the 2025 budget process is currently monitoring 23 requests totaling $652,000. Line item amounts for personnel requests include offsetting revenues and fringe benefit costs. A resolution was brought forth by the County Administrator's Office with the support of personnel to unfund the certified peer recovery advocate and the senior clerk positions, both of which reside in community services. And for our strategic plan updates for HSC departments have completed 57% of their strategic plan initiatives by the end of the second quarter. This is an increase of 22% from the first quarter. 6 essential activities have been completed. 48 are on track, 8 are slated for future progress, 8 have yet to be started, and 3 encountered a minor disruption, all under DSS. Office for the Aging saw the largest progress update thus far, having completed 85% of their essential activities for the year. And for our next quarter, third quarter presentations will be given to committees in November. Great. Any questions?
Thank you. I believe that is all of the business for today. Is there a motion to adjourn?
So moved.
Second.
Okay, you're adjourned.
Recording stopped.